So I had another great question come into the practice, and it's what's the difference between a traditional gluteoplasty or butt lift versus a BBL or Brazilian butt lift? So many have heard of both, especially the BBL, which is the Brazilian butt lift, which is essentially autologous fat grafting to your backside. And autologous means self, right? So we take your own fat and we inject it into your backside to augment it, to shape it. To do that, you have to have enough fat to inject into your backside to make a reasonable difference. And that's part of the evaluation. You say, how much fat do you have? Do you have other areas like excess fat in your tummy, on your flanks, and your thighs? And we can take that fat and inject it into your backside and then get a reasonable result. Now, if you come in and you're very fit, very thin, you may not be a good candidate for BBL. So obviously you may still have complaints about your backside, and what usually happens there is if you don't have a lot of fat, you may not have it in your buttocks, and your buttocks are going to be sagging. So if that's the case, then we can do a traditional gluteoplasty, and that essentially it's a little more invasive, which means we have an incision across your backside, typically lower than your typical waistline where you might wear a swimsuit or underwear, and we take out excess skin. And the particular procedure I do is we retain all the underlying fat and we shape it and form it almost like a gluteal implant, and we pull the skin up over it. So it gives a similar effect to the BBL, where we are getting great projection, we are smoothing out your backside, we're getting rid of excess skin. However, it's done with your own fat that is in place versus taking fat from other parts of your body. So we do both those procedures here in the practice, and if you're interested, come by the practice. We can do a consultation. I can determine which procedure would be best for you. Have a great day.